Good afternoon, everyone. My name is Amaya Vane, and today I'll be talking about Miss Felicia Evans' case. So, the reason for Miss Felicia visit is she wants her kids back, and I understand. I get it. So, the first question, um, it says, "Is there any aspect of Felicia's life that you can relate to?" No, there isn't any aspects of Miss Felicia's life that I can relate to, but we do or we will see things like this in the practice. Um, and I have um, at my experience of working at DHR, I've had certain situations like this where the parents they have similar situations to Miss Felicia. And the second question says, if not, what will you take? What will you take in establishing rapport? Being welcoming, just and creating a safe space for Miss Felicia, being active listening to what she wants to tell me, and not just judging off of her opinion or her situation. Being patient and meeting her where she is. Basically, just meeting her where she is by letting her be in the center of what's going on and just um, listening to what she has to say. Letting her tell me what she needs, and not me going off of what I think she needs or what I feel like she needs. Just letting her talk and tell me what it is that she needs. Because sometimes, you know, somebody coming in, if somebody coming in meeting a stranger for the first time, they're gonna be like, who are you? Why are you talking to me? Like, I don't trust you. I don't believe that you're gonna help me. And this is cliche saying, I care about you, which that's things that we should say to our, clients. But sometimes they're gonna say things like, you don't care because they hear it a lot. They hear it a lot, and they have people that have probably let them down. And especially with her situation, she's not going to think that I'm trying to help her. Like, she's probably gonna have her guard up and be afraid to be open and be welcoming and but be open. So that's what I would do. Maybe it's more that I could do, but that's what I would do um at the beginning, like my first time meeting her. Just letting her talk so I can know what I need to do to help her. And the third question says, what aspects of Felicia's family history can, in part, explain Felicia's dependence on substance. So, I pulled out a few things. So, Felicia and her sister were frequently left alone in the apartment, and when their mother returned, um, she will often pass out on the sofa. So that part is Felicia. At a young age, her and her sister didn't know what was going on. They didn't know what was happening, or maybe they did. They probably didn't know what was going on, and they probably thought it was okay. So they probably, made Felicia say, okay, mommy did it, so I could do it too. Or just seeing your mom do that, like seeing your nurturer do that, it's like, okay, maybe she's doing the right thing. Um, her mother Evelyn has a substance abuse issue, so that could play a part as well. Between the ages of 3, and this part I pulled out because this could play a part. In my opinion, I think it could play a part, but you know, maybe not. But between the ages of 3 and 5, Felicia was molested by her mother's boyfriend. So that could play a part in Felicia's substance dependence, because that's probably what she depended on to help her cope, to help her deal with, like, she would probably be thinking about that situation happening. Oh, she gonna go to alcohol. She gonna go to drugs and say, I want to do this because this will take away that thought or that memory that happened to me as a child. And my mother, and also her mother, didn't believe her that it was happening to her. So that probably what that probably play a part in Felicia's dependence on substance. So question number 4 says, what additional information do you need to gather to determine whether Felicia has substance use disorder based on the DSM 5. So we will look at the pattern of her substance use over the past 20 months, frequency, the amount, and the duration, the time. Like, how often, what's the amount that you use, you know, was it like, what's the time that you use it from, um, um, loss of control, using more than intended. Like, are you using more than what you thought you were using, or what you were going to use? Are you having any cravings or urges to use? And also withdrawal symptoms. And the last question is, are there any other mental health issues that you think Felicia is experiencing? So I pulled out 3, and I'm sure it's probably more. And it would be great if you guys give me, some other mental health issues that you may think that I didn't call out, so I can know, because yeah. So abandonment issues, trauma related stress, and depression, just because of everything that she's dealing with. Those are the 3 that I pulled out, and I feel like abandonment issues could be related to trauma related stress and depression. That could be the same thing, but like I said, you all can help me out with if you know that's fine, or if I need to add more. Thank you for listening, and I hope you guys enjoyed my responses.